Good afternoon, everyone. Welcome to our discussion forum today. It is titled Expanding Research Partnerships, Working Across Physical Distance. We are bringing you this discussion forum on behalf of our Primary Healthcare Research Capacity Building Committee and from the Manitoba Primary and Integrated Healthcare Innovation Network. My name is Alana Baldwin. I am Mpns, Research and Operations Officer. And today we have additional facilitators. Info Began is going to be joining us for a portion of this discussion, as well as Jen Pepnick, who's going to be doing most of the IT management in the chat box. And I'd like to just give you a couple of housekeeping tidbits. You have a mute button on the bottom of your screen. Please put yourself on mute until such time that you want to unmute yourself and ask a question. We're going to be having a very interactive session. We encourage you to jump in and have feedback and let's have a lively discussion. We also have a little bit of a glitch. We had planned on putting in some poll questions throughout the discussion. However, we're going to keep those questions and we would like to send them out to anyone who has RSVP'd with a link to this presentation and a copy of the slides and the questions at that time. So for today's session goal, we want to have an interactive discussion on ways to expand research partnerships between public members and research stakeholders and consider how technology can enhance research across geographic distance. So back in November, we convened our committee, our Research Capacity Building Committee, convened a host of stakeholders involved in primary care, decision makers, clinicians, researchers, and patient partners. And in doing so, we ran through a number of activities to which we were able to send out a report on the identification of priority actions as a result of that two-day session. And one of the three top priority actions was to establish a cross-Manitoba patient community partner network that brings patients and community partners together for engagement in primary healthcare research. So that is kind of the leading up to why we are presenting today and wanting to further discuss expanding research partnerships. So some of our overarching questions are going to be, how do we continue to build a network? How do we connect to potential members? And how do we support ongoing relationships? So moving into what do we mean when we say public involvement or engagement? Public involvement or engagement in research is defined as research being carried out with or by members of the public rather than to or about or for them. So this involves patients, potential patients, caregivers, and people who use health and social care services, as well as people from organizations that represent people who use services. So when we say public involvement or engagement in research, we are not referring to the recruitment of patients or members of the public as participants in research per se. What we mean as partner in this context are members of the public who are actively involved or engaged in the planning, conduct, dissemination of findings of a research project, endeavor, or initiative. So involvement, just go back, Jen, one slide. So what does involvement of the public in research mean specifically? That's to include voices that are traditionally less heard in research. It helps to ensure that the various aspects of the research, such as methods, outcomes, language, and content, are appropriate, acceptable, and sensitive to the very real context in which patients and informal caregivers live, work, and play. That the research reflects the concerns, the interests and values of the public, and the growing evidence engaging patients throughout the healthcare system improves quality, safety, and health outcomes. Okay, next slide.
I just got booted out of my VPN, so I'll have to log back in. Hope you can go slide.
Okay, well, the next slide is going to be on the spectrum of patient and stakeholder engagement. And this is a visual representation of the different levels of patient engagement. So engagement runs along a continuum, as the slide will show you. And at one point, which has the longest arrow going across, is the inform. That is followed by consult, involve, collaborate, and empower. So inform being the least amount of public involvement and moving down through those various phases where we get into more of the detailed specific involvement. Public partners entering at the early points, which would be inform, along the spectrum have been more common, but they are reasonable points of entry as they get to know researchers and gain an understanding about how they would like to be involved. To add further understanding of the continuum for those who have been involved in engagement, as well as those wanting to engage, we have a next level, which is the consult, in that we will consider your input and give feedback about how it informs our decisions. And that could be, for example, the engagement of folks in focus groups and interviews. The next level of engagement, more detailed level of engagement, is involve. Oh, there we are, involve, in that we will ensure that your input is considered among the choices we implement. And that could be participation with patients at some point along the research process, such as workshops and advisory committees. And then we move into collaborate. We will work together and incorporate your views as much as possible. So that's engagement and activities across the research project itself, development of research questions, data analysis, input on the final report, and so on. And then we get into the more detailed level of patient and stakeholder engagement, which is empower. And we will implement what you decide. So patients and public actively control, direct, and manage the research process. They formulate questions, design the research, and write up the final report. You will see an acronym, CBPR, should say, at the collaborate and empower points of the spectrum. That's community-based participatory research. And that is a partnership approach to research that equitably involves community members, organizational representatives, researchers, and all other aspects of the research process, with all the partners in the process contributing expertise and sharing in the decision-making and ownership. So that gives you a little bit of an introduction to what is public involvement, what does it mean, and where you could potentially participate along the various levels, from a less detailed level of engagement right through to a very informed and very deeply involved level of engagement. We are very fortunate today to have a guest presenter, Kelly Thiessen, who is going to be talking a little bit about her project and her experience with engaging community partners by distance. Kelly, are you there?
Hi, yes, I'm here.
Would you like to go ahead?
Yep, I'm just trying to get my camera to work here. Yeah. Okay, there we go. Yeah, thanks for the opportunity today to talk a little bit. I have actually a couple of funded projects that are patient engaged. One is through the Center for Healthcare Innovation that was just getting started in an acute care setting with patients and healthcare providers, and that came to a screeching halt with COVID. And the second one was entitled Sacred Spirit or Child, and it was a project that was it's now been about 2 years, and we originally submitted this project for the SPORE platform, the program policy and analysis platform. And Chanel was a big support in that. And it was a lot of work. We actually didn't get funded, but then turned the same project into a CIHR project grant, got more time to do the project and a bit more money, and were funded. So we actually engaged our partners at the outset of the project and included them in the design of the study. We worked for over a year in the creation of the proposal as a team, and it was primarily focused on Indigenous Northern communities. And from within those communities, we had stakeholders, and it was quite rich, the work that we did, and it was all the meetings that we had together were very much based with, they started with ceremony, ended with ceremony, and the stakeholders eventually named the project, which was called Sacred Spirit or Child, as we talked more and more about the focus of maternal and child health issues in northern remote communities. The theme of taking the child out of the community had been very detrimental, and the child was seen as the sacred spirit. So once we were funded, these stakeholders continued to be involved, but then it branched out into the actual communities where we took the primary community contact who was represented on our research team. And we did initial travel, and we created Indigenous advisory groups within each community to further define and guide how the project would then roll out at a community level. And so the jurisdictions that we chose were Nunavut, Nunavik, Northwest Territories, and Northern Manitoba. And within those 4 jurisdictions, we have approximately 11 different communities, 2 in Manitoba, 4 in Northwest Territories, 2 in Nunavik, and then 3 in Nunavut. And then, so the initial travel to all of those places, I took on, my co-leader is Elder Catherine Whitecloud, and she gave me the blessing to travel without her because she's extremely busy. But we connected almost weekly on the progress of our trips and the progress of the project. We got all the initial travel visits done in 2019. And then we also were able to, the second phase was then within each advisory group in the communities, we did 2 full work days. And so the way we included our stakeholders was basically taking the project goals, which were to deconstruct the maternal and child health system to better understand how it's meeting needs, how it's not, what are the barriers, what are the facilitators, and what does the community feel like they need to understand more about their healthcare system to be able to advise or propose change in terms of how the evidence would be, how they'd use the evidence that we were generating. And so I took a framework to the work days around the idea, and then the stakeholders who were elders, midwives, band counselors, health directors, community health workers. So we had a real interdisciplinary team, wellness workers. We even had some student midwives, student nurses that were on our advisory teams. They basically created the interview guide, and every community did so differently. And so it's quite interesting to look at how there's still, and I never shared the interview guide between communities because I didn't want them to be influenced by what was happening in Nunavik or what was happening in northern Manitoba. And then once that everybody agreed on the final interview guide, we chose somebody on the team to do the interviews, and we hired them and supported them in that way. And so we had just started those interviews, and again, then COVID hit, and we had to stop those because in the north, well, the borders have been closed and travel has stopped, and it's very relational. So I'm interested to hear about how people are doing things, patient or stakeholder engaged research by distance, because for us, it didn't seem feasible to continue on with the particular contexts that we were working in, as far as these are already strained systems, and now we have the threat of COVID, and it's relational, and we need to actually do these interviews in person. So phoning people, emails, it doesn't actually work well with this type of project. So we're at a real standstill in terms of our data collection. There's two phases. We were doing interviews, and then we were going to bring the results of the interviews back to the table and have, I was thinking of ways how we would have the advisory group will help analyze and interpret the meaning of the data, and then ask further questions based on what we learn. And we would take those questions to the elders and do sharing circles. So we have several layers of data collection. And then the last phase would be that we would think as a community or as a group, how they want to use this information. So it doesn't just go into a report and sit on a shelf. So I have very much had a hands-off approach, and it's a little bit daunting to do it this way, mostly because sometimes you don't always know what the outcome is going to be, and we're used to sort of controlling the direction of things. But it's been extremely rewarding and authentic to take a hands-off approach, to give guidance, but to trust process. And that's not always easy either, to trust process, because I don't often tell them a lot before I go to the workday. They don't really, sometimes they say, well, we don't really know what do you want from us? And I said, and it's really a matter of reconditioning how people think about research, because they have been left out so often. It's just a new concept for them to be engaged in a way that they actually have more control, and then they get really excited and invested when that happens. So that's pretty much it for this project. That it was a 4-year project. Well, actually 3, we can extend it to 4. We were really on track with most everything, and we're into our 2nd year now. But like I said, we've stopped everything because travel to the north has stopped, and I don't know what the future holds for this. I would say I feel we had great momentum, and I am sad that I'm unsure of what this will mean, the project, in terms of the feasibility of getting it done now with what we're dealing with.
Okay, well, thanks, Kelly, for giving us a really wonderful description of your work, including the challenges. Does anybody have a question that you want to ask Kelly at this time? We've got Kelly for a short period of time here through this discussion, and now would be the time to ask if there's anything in the chat box, Jen.
I have a question for Kelly. Well, first off, congratulations on your bachelor's program. And secondly, how do you, or have you maybe even discussed this with your patient partners? How do you think this idea of using technology is going to sit with everybody? Are they feeling kind of receptive to it? Does that seem to be something that everybody's, quite willing to take up, or what's kind of your sense of that?
Yeah, I think it's a great question, and that's where I think I hit the wall, because we have found the most effective way in working with with the Indigenous communities and partners have been in person. So making the trips and by phone. And so we often don't get a good response from people by email for whatever reason. They don't check email. It's not a way of, you know, as academics, we're on our email 24/7, and it's just kind of a way of life. And it's just not for them. That's not how they primarily communicate. I have not broached the subject with any of the teams, mostly because I think the pandemic has really created a lot of stress in these northern communities in terms of their capacity to deal with just what they need to deal with, and then the fears of the what ifs. And I feel like research is not a priority to them. And so to be sensitive and respectful, I have completely backed off and have said that we're not continuing on, and people have agreed with that. And I mean, the other thing is that we have to get confidential, like we have to get, in other projects I have, when I have people doing data collection and whatnot, they do the Tri-Council core ethics modules, and they're fairly lengthy and take some time. And we decided not to do this with our Indigenous stakeholders because it didn't feel like it was practical or relevant, even though we needed to get some type of confidentiality statement. So we crafted an oath, an oral oath for them. And we had been calling around and getting just some of those things done now that we're not doing data collection. So I don't have a great answer. Like, I haven't broached the subject based on my, I guess, perception of how we have dealt with people in the past. And I don't know what the way forward is, I guess. I feel like I'm okay waiting and writing a little bit of the summer out, because summer months were also not months that we had planned activities because people go on the land. So it was going to be kind of a dead time for us anyway. So we were going to resume and pick up full speed in fall. And so I thought, well, I'll have to have a plan by fall of how to re-engage and figure out what's respectful.
Hi, Kelly. We have a question in the chat. Are the interviewers distinct from the interviewees? And if so, why is that the case? I think you're on mute.
So is the question, are you asking if the interviewers are not co-located where the interviews are happening? Is that the question? Yeah, no, all the interviewers are in their own community. So in every community, we have local interviewers. We have a local interviewer that's a part of the Indigenous, so we have either Inuit or an Indigenous person that's, well, I think the lack of connection is that people are preoccupied with other things. So I'm a lot of these people are wellness workers or health workers, midwives. So they're preoccupied with other things. And so doing these interviews are not a priority right now for them. And so I'm trying to be sensitive and respectful to their workloads.
Okay, well, thank you again, Kelly. Are there any more questions before we move on to the next piece of our discussion? No? Okay, well, thanks so much for joining us, Kelly. We really appreciate.
Thank you for the questions.
Yeah, we really appreciate your participation, and let's move on to the next piece of our discussion. which is we want to give you a little bit of a description of MPN's partnership network and our patient advisory committee. You know, as you all know, we are a network that has a very big mandate to include patients in the public, caregivers, the public in the work that we do. And we have been very busy over the last year in particular, building upon this piece of our network. And Jen is going to give you a little bit of a description of some of the work that we're doing. Go ahead, Jen.
All right, so I'm going to keep this nice and quick so we can move on to more discussion. But really we have two ways that we try and connect with public and patients to get involved with research. The first is the Patient-Public Research Partnership, which is a network of individuals who said, yes, I'm interested in potentially getting involved with research. Let me know and keep me updated on what opportunities are out there. So we send monthly updates on ongoing studies. Some of this involves, these are studies that are looking to partner with patients, and we give them a description and how much time is expected so they can decide if this is something they're interested and would like to participate in, if their experiences are relevant to the study. And then along with that, we also provide updates for ongoing and past studies, just so people hear what's happened and that it's not just all going into the void, but actually making differences in these ways. And then along with that, we have an advisory group that really helps us to stay on track and making sure that patient and public priorities are involved in our design, implementation, and all parts of MPN, and that we don't miss anything in that regard. So they provide a lot more guidance that way and meet quarterly. And yeah, that would be what we have on the go now, but we're very interested to hear from especially our patient partners on ways that we can keep building and modifying to meet the needs of patients. And from there, I'll let, unless anybody has questions, we'll take on from there.
Okay, Jen, is your next slide? You've got a next slide there. Is that the contact?
Sorry, yes, totally forgot. If anybody wants to get involved in either of these two aspects of patient and public engagement, or they know people who would like to get involved, they can contact either myself or Chanel, or go to our website for more information. So this will all be sent out to everyone who's RSVP, and we're happy to answer any questions you may have, even after this.
Okay, so thanks, Jen. We'll move forward now with our next session facilitator, and I'd like to introduce Mfo Biggin, who is going to be talking a little bit about how can we utilize technology to optimize engagement. And as you've heard from Kelly, certainly we are faced with a number of challenges in our current environment regarding our use of technology. Where do we want to go with it? How will this look in the future? And so, Mfo, are you there? Mfo?
Yes, I'm here.
Oh, there you are. Okay, good. Yeah, so please go ahead and let's do a little bit of exploring on this topic.
Okay, so this is just going to be a general discussion, and I'm going to need input from from everybody to kind of get that perspective on how we can utilize technology to optimize our engagement. Especially after the post-pandemic, we are certain that things are going to be different. How do things? So technology is going to play a very important role in keeping engagement with the public and the patient and the community. So I just want to get an idea of understanding what the public what kind of technology platforms are available to the public, and what are they comfortable with using in terms of technology, whether it's email, engaging through email or phone, or using virtual platforms like Zoom or Facebook or WhatsApp. We have other technologies. So I just want to get an idea of what people think of using technology to engage in research.
This is Connie Newman, I guess a community engagement person. I am also over the age of 65 by the senior category of the federal government. And since COVID hit, I have done more Zoom calls, more surveys, more teleconferences than I did before COVID. As long as you're in the city of Winnipeg, when you go beyond Winnipeg, the internet access is not quite the same. So anything that you've suggested is good. Just a sec. Anything you've suggested is workable. The only one that I haven't seen used in the last 8 weeks is WhatsApp. I have used it, but I haven't seen it as part of any research or any, what would I call it, meetings, etc. But all the rest I've seen used by myself and other older people. And I can say that today I'm in connection with 10 senior serving organizations. So that's pretty representative of what's out there from the older adult point of view.
Okay, so we can agree that seniors are more comfortable in using technology. Okay.
Hi, it's Jeanette. I would say I totally agree with Connie, but I think the whole world in this world is much more amenable to using technology by virtue of our need to connect with people and not physically. I also agree with Connie regarding the variety of platforms that are being used, and so I've had exactly the same experience.
Okay, thank you. So Connie mentioned something that's interesting, that as long as you're in Winnipeg, technology doesn't seem to be an issue. But going beyond Winnipeg in rural communities, some communities might not have any access to the internet, so they might not be able to engage in technology. So I just want to get a sense, are there any ideas how we can engage those communities where they might have an issue with accessing, having access to internet or cell phone, besides having to travel? Are there other options?
Just to clarify, the internet access depends on where you are. And we also have, I think Jeanette would be able to telehealth, so there may be something through that system that will work for beyond the perimeter. But anytime we plan anything in this province around technology, there are many dead spots that could get in the way of what you're planning from a technology point of view.
And we did have a comment in the chat about low income being an issue for being able to access some of these services.
Absolutely.
Mm. Yeah, that's a good point. Low income is a challenge.
And just to read out again, another point on that is, Kara had mentioned I'm having trouble, or I'm trying to figure out how to figure out if I can allocate grant money to provide technology to support some of my public partners, and then I'm not sure if it'd be difficult in the learning curve if they can't be taught in person. So making those, I don't know if you want to say that, Kara.
Yeah, I have some I have some partners, like my project is not going forward because I have some people who don't have technology at home. So I thought, well, I'll just use some grant money for it and, you know, go, you know, live with less RA support or something. But then I'm worried that I'll buy it and it won't, like, then will they have Wi-Fi connection? You know, I can't, can I buy Wi-Fi for people? Like, I'm just kind of stuck because I don't really, I'm not a technology person. I can, you know, make a Zoom meeting, but I feel like I need support in figuring out maybe the best way to provide technology to people that don't have it and aren't used to using it. And then there's the issues around privacy. So some people might be able to FaceTime easily, but you know, if you're asking people to look at documents and that kind of thing, I'm kind of getting stuck on the barriers, even though my folks are not in Nunavut.
And Dennis also brought up a good point of some people not feeling comfortable with using it, even if it is provided.
Mm-hmm. Yeah, those are good points. Yeah, so we talked about having different using platforms. How about, I guess, for those who are able to use technology, is there any interest in using something like online discussion boards instead of having in-person meetings? Is it something that somebody have done that, or they're interested in trying that?
Isn't that sort of what we're doing now?
So online discussion boards is kind of like a forum where you can kind of, it's similar to Zoom, but it's more kind of more like, how do I describe that?
Do you want me to jump in here, Info?
Yes, please.
It's where people can hold conversations in the form of posted messages. And so they can message back and forth, and it's not quite a live video conferencing, but more along the lines where you can discuss back and forth, and it's a forum for that.
Sorry, this is Patty. Phil, I wondered, I didn't quite catch the name of the actual technology you're talking about right now, but I do want to flag for people that Google Docs can work for that, yes, which is a little lower learning curve. If people are used to working on Word, it's very, very similar to Word. It does need access to data, you know, to work, but you can have synchronous or asynchronous discussion in there. So we've used it in our recent engagement sessions that we pivoted online in response to COVID, and our participants wanted to keep going. And so the beauty of it is, particularly from when people are brainstorming, you can set it up so that everybody's an anonymous poster in it. So that's something we've been doing in terms of particularly evaluation around how comfortable people are feeling in the session, what they think the biggest takeaways have been, that sort of thing.
Okay. Are there any more questions or comments before we move on to our next topic? Oh, Dennis. Okay. Discussion. Okay. Okay, so we're starting to see a number of suggestions come up in the chat box of different kinds of technology people are using. So thanks for that. Do we want to move on to the next discussion. I'm just checking the time here, and I want to be sure that we cover a few other topics. So we better move on to the next one. Jen, do you want to just flip the next slide, please?
Should be there.
All right. So after these discussions of these topics, as I said, you know, we have a few questions we're going to be sending out, and we're going to get a little bit more, we'll be asking you to get a little bit more feedback on some of the areas that we've been exploring through this discussion. But let's move on now to how does the how does the public want to be engaged? And I think that this is a really great question. I think that there's lots of discussion that could be created as a result of exploring this. And I think my first question out there to everyone is how can we best deliver messages to the public to stimulate interest in research? What can we be doing to help move public engagement forward out there to the public?
It's Connie Newman. I would suggest an awareness on your part of the many networks that are out there. There's networks within the health system, but there's also networks around children, Parent-Child Coalition. There's community networks that you can access through the Regional Health Authority. There's age-friendly networks. So there's a lot of networks, and to get the community involved, you need to ensure you've got all those networks on your list.
Connie, what would be the first step in terms of how you would approach those organizations? What do you recommend?
Hi, it's Jeanette. I wonder, in my mind, and Connie and I work together a lot, is my first suggestion is you approach those organizations by asking them what they might be interested in, rather than feeling that you're selling them engagement in research. Like, I think the gap has often been, what is the public also interested in gaining a greater understanding or having more evidence? Sorry, Connie, I think I cut you off, but.
It's just fine, Jeanette.
There you go. So I think it's I think the way you worded the question, how do we get people engaged? I think by asking those groups, of which there are many, what their interests are, what their needs are.
And what the issues and concerns are. I'm just sitting here thinking about, I'm connected through the Manitoba Seniors Coalition, and we've got about 10 topics that we have issues around. So ask the Manitoba Seniors Coalition what those issues are, would be maybe a place to start if you're looking at older adult research. But there's all kinds of different groups out there.
What do you think is missing in terms of when it comes to supporting engagement of the public in primary care research? What are we missing here?
Talking to the front line.
Okay.
And I'm going to call it plain language. Sometimes we, and I have my master's, and I'm very aware of jargon that's in the research field. And if you ask the public, it has to be, in my mind, in plain language. And one of the statements I put in the chat box, I am not a patient. I'm a member of community. And I realize that word patient may be a research term, but it's not user friendly. Like, I don't define myself as a patient. So that kind of is important. And if you're bringing research to the public, you have to meet them where they're at. COVID has caused a problem here. I'm a firm believer in feed them and they will come. And so in your research dollars, that whole idea of going to them, depending upon what the travel is like, once we open up from COVID, going to them in a friendly environment. I think about senior centers. We've done some work with connecting some researchers to a senior center and doing focus groups at a senior center, as opposed to bringing them to where the universities, I'm going to say, or the colleges would be another.
Well, you've raised a good point about language. Is there a better language that we could, that needs to be considered in place of the idea of research? You know, using the word research. Is there something that we could replace that word with, and that would make it a little bit less academic and a little bit more acceptable in terms of engagement?
Research, no. Well, an opinion, if you're asking people for their opinion, which is sometimes what you're asking for when you're doing the research, the word opinion may be at the public level a better word. I don't know. The word research has never struck me as being off. I don't know.
Okay. Jen, what do we have in the chat box? Is there any questions we want to field for discussion there along the lines of what we've been talking about?
I think it's a lot of affirmation of, we really do need to make sure we're using language that's understandable for everyone. And perhaps maybe on Connie's point, would asking for people's opinions on what we are researching be a better starting point than asking them to be engaged in research?
Yeah. Okay. If we could deliver one thing for public engagement in the next 6 months, what would you want that to be? Any ideas? Any recommendations?
It's Connie again. I'm real concerned about coming out of COVID and social isolation and coping with our own mental health and taking care of ourselves. And the whole idea of phrasing it in a positive as opposed to the stress around isolation. And there is some research already happening, because I answered a survey this weekend around my own personal mental health and COVID. So there's some stuff happening out there, but I think as we move into our new world, what we look like coming out of COVID, I mean, we're in this for a while, and as things open up, there's going to be restrictions for a while anyway. And how do people cope would be my suggestion.
Yeah. Yeah, good point. Okay. Any other comments? Questions? Anybody want to, oh. Okay, I'm just reading. So something we need to be better. Well, what did Jackie say? Okay. What is our next slide there, Jen? What do researchers need to better engage the public? So that's our next topic that we want to explore. So all you out there that are doing research, there's a number of you online that are attending today. What do you in the role of researcher need to better engage the public? Anyone?
We had a comment in the chat about ideas and ways to engage the public remotely, especially at this time where we can't meet physically.
Okay, and what did that say? Sorry?
I think one of the challenges that we've kind of felt is that, you know, we've got these research ideas that brew, they start to sort of, you know, take a little bit of shape, and we want to get, you know, partners, public partners, to kind of weigh in, help us develop this idea further in a way that's meaningful and relevant. And one of the first challenges is always, well, where do I go? Who do I turn to? Where can I find these individuals who might be interested in this work? So I think that was sort of what this network, MPN, had in mind was, so we're a network of individuals, let's expand that network to members of the public so that, you know, we're all a little bit more connected, and then that kind of relationship builds a little more easily. So that's kind of my understanding of where we're at. But I think in this current context, it's that much more difficult because we don't have great opportunities to build relationships right now unless they're by this technology. And even if we look at what we've experienced in this hour, it's sometimes a little bit difficult to get the discussion really flowing and get those ideas out there. So I wonder if that's something that we need to tackle is, you know, what is this role of technology and how are we going to use it in the next little while, because COVID ain't going away so quickly. How are we going to use it, say within the next year, to really build a strong network that includes public partners in a meaningful way?
Mm-hmm.
Just, if I could add something to what Gail was saying. Hi, it's Alex Singer. It also is very project dependent. And I mean, one of the things in the COVID world has been timelines have been extraordinarily short. So it's like, you know, you have 2 weeks to get together, to get a proposal together, and also you want to engage patients. And so for a COVID, quote unquote COVID type project, you need to have sort of a contacts, a roster at the ready. And some people have some contacts and some people don't. And so one of the things that the network could do is to be that sort of facilitator or sort of provide partners among people who've already expressed an interest of being engaged. The other challenge, though, in sort of different contexts or sort of different types of projects is balancing the need to include citizens, patients, you know, the public, quote unquote, without narrowing to just the people who already sort of have a voice and agency. And so that's also it's a particular challenge when you're looking at research, you know, related to you know, marginalized populations or any kind of area where the people who are affected by the condition may not be the people who typically put their hand up and say, I want to be a part of research, or I'm political in some way, I have some agency. So I think the other aspect of the network could be, again, to be a connecting line to either representative groups or individuals who, you know, within communities that are sometimes hard to reach or who may be outside of the typical networks to help sort of make those connections. And so to sort of cross those bridges and bring researchers closer to, you know, the public, partners, citizens, for whom they may not otherwise have close contact with. You know, I can ask a patient of mine to participate in a project, but I have a particular patient population, and it may not be the patient population that I want to research in a different kind of project. So anyhow, just a few ideas.
Excellent. Thank you, Alex. I see that we've got 3 minutes left before the hour is up. It has flown by, and I feel like we're just starting to get warmed up. We could almost use another hour, but that is not the case here. So with the last few minutes, I'm just wondering if there are any other comments, anything that anybody else wants to say before we wrap up and say goodbye. Yeah, Jennifer, anything in the chat box for now? No? Oh. Okay, well, we are getting close to the 1 o'clock mark. And as mentioned, we're going to summarize the comments, certainly, and we'll be following up with everyone with our poll. Apologies again that we couldn't get that out. I think that would have been a little bit more of an interactive session using our poll questions and getting your responses in that we could look at. But that's okay. We will follow up after the session and be in touch again. So thank you very much, everyone, for attending and participating in this discussion. I think there's a lot of really great ideas and a lot of comments that we can really reflect on in terms of moving forward. So thank you for that, and everybody have a good rest of your day and a good rest of your week. Thank you. Goodbye.